because there will be co-education. So in that condition, it is very, very essential for the family support and mainly the support of the mother to the grandchild. And the socially, and it is a very bitter truth if anybody will not or agree with me that how the now in society the 9 years, the 10 years, even just in YouTube, that is the one day before I got the information that one seventh standard the girl, she was pregnant and died during the labor. So this type of I think in Hinduism or in Ayurveda, it is not advising for the society and for the family. So if because the girl child care she can't take because she's not that much of the age that she can take her care. So it is the whole and sole responsibility of the family, of the mother, that how to take the care and how when to give her feeding, that is the mental support, that how to take the care of her physically, her dress, her diet, and her hygiene, her the that is the private part, how she will take the care. So everything we have to give the feeding and give the support to her. So life journey of the woman have to pass from three phases, that is Bala, Rajaswala and the Brudha, already I have been told. And Rajaswala Paricharya, a mode of living duration, the menstruation, that Ayurveda has prescribed a mode of life to be adopted by the menstruating woman, a series of do and don'ts. It's called as the Rajaswalacharya, which aims to protect the health of the menstruating woman and prevent any the health defect of the reproductive organs, and it can prevent the so many diseases of the reproductive organs also. So Acharya treated Rajaswala, Rajakala as a natural Sodhan Kala. We can say it is also a bloodletting. So Rajasa Suddhate Nari. So that's why it has been told. And leading to the Agnimandya. According to the Ayurveda, menstruation is naturally occurring, the Sodhan procedure occurring monthly. So it is necessary to follow the Pathya Pathya mentioned under the Sodhan therapy, which is similar to Rajaswala Paricharya. And if we say during the menstrual period, the diabetes is less than compared to the male, because due to this Sodhan. And during this Rajaswala, so what are the upojogi vyanjana, or what the diet we have to? So if you see, that is I have prepared with this banana leaf, and it is the halwa. It has been prepared from the flower of the Asoka. One of my students, he has prepared in the Women's Day, International Women's Day. We have done one competition of the recipe for the female. So it has been awarded at the first prize, and with this rice flour and jaggery and this paste of the Asoka flower, it has been prepared. But it is a very, very essential, and we have to give this all the menstruating girls. So it will be it can prevent all the menstrual disorders, and even it can prevent the infertility also. Everybody know that is the Ravana, he has kept Sita in Ashokabana, and we see that is the how many years together that Sita was living with Ramchandra, but still then she was not pregnant. But after this staying in Ashokabana, and when she came to the Ayodhya, then she was pregnant and giving the birth to the male child, that is the Lava and Kusa. So in this during this period, that the Artava Pravartaka Ladu, Artava Janaka and Artava Pravartaka, then Java Panaka, then Sali Chawal, Kheer, and Japa Kusum Pana. So I have already mentioned that how it will be prepared, and It has been mentioned in my slide, so I will not take the more time from the next speaker. So it will be, I think it will be very easy. That is the til laddu, everybody know it is the til good and the nariyal powder and with ghee. Then java panaka with the water, java and sarkara, mixed it and prepare the drink. Then we are also prepared one the energy drinks also for this girl child, that is only prepared from the khajur, then draksha, amlaki, guda, and some the lemon juice. So it is giving very tasty, and in this portion we are just distribute this energy drinks, and everybody was appreciated. Chawal khira. So, and the Havisarna. So, what are the do and don'ts? Activities is contraindicated during this period. That is, avoid the day sleep, and the bed should be special. That is, prepare of the darbha, or the sacred leaf plant. The and bed over the ground. Then application of the anjana, crying, messaging, laughing, talking too much, and exercise must be avoided. Use the use of Swadan Karma, Bhamana, Virechana, then Nasya Karma is also contraindicated. And the diet which is contraindicated, it is the pungent, that is the all Pitabadhaka, the spicy, salty foods. And no any cosmetics should be no under oneself, and not wear the garments and the jewelry during this period. Then indicated activities and diet are always the concentrate and thinking of the good and auspicious things, because Rasabahini Dusyanti Chintanam Ati Chintanam. So the mental peace, it will be give support that to regularize the menstrual cycle, the regularize the hormone, and they ultimately regularize the menstrual cycle. So eat the habis. Habis means now it is the month of Kartika is already been started, and if you see that in Jagannath temple in Puri, that all the maximum the widow or the elderly persons, they are doing the Habis. Habis means that is before the sunset, one time have to take the Sattvic Ahara, and it will be the no any type of the this pungent or any spicy or much of the rich foods are not taken. It is only very light foods, and ghee, sali, rice are mainly sali, sastika, and the vegetables they are taking, and before the sunset. So this should be followed by the menstrual period, and the utensil which should be taken, it must be the clay or the leaves. So some principle behind this Rajaswala Paricharya and its application today's lifestyle, that is the diet, is the principle must be, that is the principle is Dipan Pachan, Vatanuloman, and Agni Dipan. Then application is eating in proper quantity, light diet on regular meal time, avoid the spicy, oily diet, bakery foods, then junk foods. Avoid the fast running, laughing, overtaking, avoid the jerking vehicle also, which can be prevent from the excessive bleeding or the asruddha. So avoid exercise, take the rest, and restore the energy. I think some countries also they are giving the this leave is allowed during this menstrual period, because it will have to take the rest. And I think in India also it may become in future just like the child care leave. So third one is the good and the virtual thoughts, and avoid the crying, because Visada Rogavardhananam and the Rasavahini Dusyanti Chintanam Ati Chintanam. Then So the keep the mind calm and relax as possible, avoid the stress and anxiety, which will affect the uh, hormonal regulation. Then the sleep on the darbha mat and no bathing, because bathing is contraindicated during this menstrual period for that purpose that it will be, if we bathing in during this Raktamokshana period, then it will be temperature, body temperature will be affected. So that's why, and it has been prohibited for the bathing. Even in delivery also, the 10th day, there will be take the bath, 6th and 10th day. So for that, for the temperature maintenance of the body, it has been advised by our acharyas. Instead, aseptic also, it is decrease the association of the symptoms. Then applicant sleep on the darbha mat if available. It get relief from the backache and the body ache. So bath is contraindicated, but the follow the basic hygiene like the cleaning of the genitalia, hands, legs, etc., face, etc. No listening of the loud voice. Avoid the bath prakopak and rasadusti to keep mind calm. No listening to loud voice. So no abhyanga, it is contraindicated in Agnimandya condition, and no abhyanga, no messaging. So some factors, so influencing the nutrition in adolescence. So these menstruating period or adolescence period. So lack of the knowledge in the family and the community about the importance of the nutrition during the adolescence girls. Lack of food because of the socio-economic circumstances, inadequate distribution of the food in the family wherein girls being denied the nutritious food, poor dietary intake of the food and vegetable rich in iron, poor bioavailability of iron in the diet, hookworm infection, disease like malaria, bad cooking habit, that overboiling the vegetable and straining water, then removing the husk of the wheat, then eating the polished rice and straining rice water, etc. Then perpetuation of the vicious cycle and malnutrition infection, which might begin even before birth and may have more the serious consequence for the girl child. So if you see, uh, just nowadays the certain foods which is using by the adolescents, girls or the childs, girl childs, so it should be prohibited, because how it is affecting the nutrition, that is the harmful effect of the fast food, the junk food, fast food, processed food item made from the white flour, sugar, honey, and all the junk is high in rising day by day. And the fast food induce the include the chips, soda, cookies, candy, breakfast, cereals, then the bars, French fries, burger, pizza, white flour baked goods, and all other the high calorie, low nutrients foods that people often eat multiple times per day. These food items contribute to obesity, diabetes, heart attack, strokes, dementia, and cancer. This has resulted in decrease the longevity also. The fast food, processed food, and commercial baked goods and the sweets may also be linked to destruction of brain cells and lowering the intelligence. Candy, sweetened baked goods, and even stimulate the brain in addictive fashion, which can lead to more serious illness. The nutritional fundamentals accepted by the WHO and the most nutritional authorities today include vegetable, beans, nuts, seeds, fruits, and healthy foods. So salt, saturated fat, and excess sugar as disease causing, the excessive amount of animal product also may lead to the premature aging, increase the risk of the chronic disease. Diet should be taken as per the Ayurvedic principle, beneficial to preservation, the health and prevention of the disease also. So what to eat? A young person or a young child, diet balance across the five good food groups they should eat that is plenty of fruits and vegetables, adequate quantity of the rice and other cereals, some milk and dairy products such as the yogurt, cheese, some meat, fish, poultry, eggs and nuts and legumes. In addition, they should choose the food that are low in salt and limit the foods that contain a lot of fat or sugar. So feature of the normal menstruation. So uh, the during the menstrual cycle we should give the mental support and tell everything that how many days there will be bleeding from the vagina, and so it is the only it is the 3 to 5 days, and it is the how the color is the gunja phalam savanam, so it is the just like a blood like the color, and basona biranja, that is the how it can be, that is it should not be stained in the cloth. The if you see that is nowadays, that is the modification we can see in Rajasala Sadhya we can do according to the era, that is the state wise and region wise paricharya. In some parts of the Kerala, on the onset of the monarchy, tila taila and the egg white is given for the 3 days to promote the ovulation, and this samanya vishesha siddhanta, that is it is giving the highly nutrition. So food to be avoided during the childhood, that these are the chocolates, pizza, burger, and lays, and cold drinks, etc. And common lifestyle disorder like it can create the diabetes, obesity, hyperlipidemia, and hypertension in future. So, so the we have to avoid that is the more sugar, salt, and the bakery products, fast foods. Otherwise, it will develop the obesity and the PCOD also in future, which can be create the infertility. So, so practically, wash the body twice daily, avoid the hair wash during this menstrual period, take the light diet, that is the Javanna, then Kostasodhana and the Vatanuloman, for that we can take advice for the uh, Harita Kichuna with the Sunti. Then psychological well-being, avoid the Vegadharana, heavy walks, weight bearing, importance of the mainly the counseling is main the medicine, that is it can reduce the anxiety during the menarche, so it affects the school life, then the astigmatism, social withdrawal, counseling is the very important, and it should be given by the family members and the mother mainly. So, and during this menstrual starting period, there may be dysmenorrhea, there may be the hypothalamic pituitary ovarian axis dysfunction, and due to that, there may be the excessive bleeding also, abnormal uterine bleeding. So, in this case, so it is due to the decrease the pain tolerance in a region. So counseling may advise and maintain the Vatanuloman prior to the cycle. That means 1 week prior, Tripla Chuna or Haritaki Chuna with Sunti also we can advise. So with this home remedies we can treat and we can prevent the progress of the disease and the complication of the disease. So avoid the constipation, constipating food, fast food, frequent intake of the Ushna Jala during the menstruation. And the Asruddhar, so I told you that it is the initial stage when the menstruation is starting during the menarche period. So it is the immaturity of the hypothalamus pituitary ovarian axis and a irregular cycle for the first 2 years of the monarchy. So no treatment, but always the mothers are so hurry and worry that they're coming that my daughter is not getting the menstruation. But don't worry, because it is the not established the HPO axis. So no treatment is required. Only we have to give some Batanluloman drops, and we have to remove the constipation, and check the hemoglobin and ferritin, correct the abnormalities if any. Then the Asoka Kirapaka, Lodhra Kwatha, and I have told that is the Asoka flour, the halwa prepared from the also flour we can give, and the fruits like dadima. Then in some cases we are seeing that this childhood or the girl child there is the more obesity, and due to the obesity there is the artavakaya, or there is the irregular cycle, that is the timely not the menstruation is occurring, and it is the very scanty and the painful menstruation. So it is sometimes the due to the immaturity of the hpfcs, and so in this case also we can avoid the treatment also, and only this Vatanuloman drugs we can give, and the pain clear, and main is the Sunthi and the Buddha, it is the best for the childhood, that is the menarche or the first menstrual cycles. So that one more thing, that is the precocious puberty or delayed the puberty. So both are the important. In a delayed the puberty, we have already been discussed that it is depend upon the ahara and the arogya. So it is depend upon the normal health of the girl child and the diet which we are providing, that is the nutrition. But precocious puberty, it is the appearance of secondary sexual the character before the 8 years, and menstruation start before the 10 years. So in that case, it is very, very important for the family and mainly for the mother, that how to counsel the baby if her daughter is having the precocious puberty. So it is very, very responsible of the responsibility increase to the mother, not to be worried. So delayed puberty, no appearance of the secondary sexual character up to 14, and the menstruation not started till the 16 years. It is the upper limit. So again, you have to uh, attend the OPD of the gynae OPD and contact with the doctor. Then it will be better to what is the problem, that is the doctor can be, not in this webinar we can be if the solution. So evaluation needed to the appropriate investigation, modern lifestyle to affect the age of the menarche also. So maintaining the quality of the artava. So Ghruta, Khiradi, Nitya, Mudisate, and a Kapanastu. So daily take Ghruta, Khira. So it has to give him to the girl child, so that it can be prevent the this menstrual irregularity and maintain the quality of the artava, or that is the future, that is the sperm, that is the ovum and the ovulation and the menstrual cycle also, or the menstrual blood. So Kasyapa, our the most the pediatrician of the eminent pediatrician of the Ayurveda, is telling that take care of a girl child in short, that is if there is a malnutrition, then give the Kalyanaka Ghruta, Chatpala Ghruta, then after 7 days, then some Mrudu Sodhan with the Tribrut Khira, then daily taking the Ghruta, Khira, then the proper sleep. It increases the Mansa, Meda, and a Asruk Vruti. So we know that is the Asruk, it is the Sonita, and it is the Artaba, or it is the menstruation, and it is the from the ovum. So that is पाचित पित्ततापेन रसोद्या धातवक्रमात् सुक्रन्तं jantimaसेन तथा स्त्रीणाम् आर्तवं भवेत्. So diet which is given to the girl child, after 1 month it will form as the artava or the menstruation. So the proper food or proper diet, it can there will be proper menstrual cycle and proper the reproductive organ growth, and it can prevent the all the reproductive disorders. So Sali rice with the Mudgamanda during the Sarat Rutu, and a Sneha Vimardana at the night, that is the Nidrakara, Baldya Vardhana, and the Samanasa. Daily giving the message should be given to the girl child also. Lasuna Kalpa, Nagavala, then Drakya with the Sarpi, that is ghee with this Draksya, then Aja Khira, and a Pipali Khira, that is the Nagavala Khira within 1 month malnutrition with the complication, all the complication is the disappear, and in case of the Gudaroga, it may be, there may be, if there is any due to the constipation, sometimes we are getting that is the fissure and the piles also in the childhood. So in that case, give the milk, javarna, jangal mansa, then the snehajukta, with snehajukta. Then in this vibhrama, or we can HD the child which you are getting. Or so in that case, Javarna, Sali, Mudga, Dhatri, Dadima, Saindhava, with the Nasya Karma also we can advise. Then take a message, that is follow the dietary guideline which is given by our Ayurveda. Due to the time limitation, so I can't go all these things. The Ahara, Vidhi Vishesha Ayatanani. The best diet for the obese and the lean person, that means the obese and the lean girl child. So two types we are getting the this girl child, that is one is the malnutrited and is the overnutrited. So which is overnutrited, guru cha aditarpanam chesta sthulanam karsanam prati. So which is obese, so we should give the karsana, and the kusanam bruhanartha cha laghu santarpana cha. So which is the lean and thin, we should give the bruhan therapy. So the heavy and the non-nourishing diet therapy are prescribed for the slimming in the case of the too obese, while for promoting the bulk of the too lean, light and nourishing therapy is prescribed. That is mental support like exercise, yoga, pranayama, dinacharya, rutucharya, ratricharya, and proper sleep, proper dress, hygiene, social relation, and the family support can help in achieve the goal. So thank you for patientful hearing.
Excellent,
Namaskar.
excellent.
So
Really
without a lifestyle
mesmerizing.
in your family, you can't have the prosperity, happiness, and the glory. Always respect her and care for her. So happy National Girl Child Day. Once again, thank you. Namaste.
Thank you very much. Avismarani, mesmerizing, continuous. Really, I salute you, Lakshmi, for your zeal. Agnihotri sir, she having fracture in leg,
Oh,
and yes, then also she gave me consent for 20 minutes, and she took 1 hour. Excellent, flawless, excellent. Thank you, माँ लक्ष्मी, thank you. अभी लक्ष्मी पूजा कल ही हुई है ना, तो आज लक्ष्मी जी दर्शन दे दी.
Namaste. Namaste.
हरिओम हरिओम. So now I would like to request Professor Dr. Thulya Mohandas, Vice Principal and HOD of Department of Kai Chikitsa from Ayurvedic College, Coimbatore. Welcome, Dr. Thulya. Welcome.
नमस्ते सर.
नमस्कार.
नमस्ते अग्निहोत्री सर जी.
नमस्ते जी, नमस्ते, खुश रहिए.
अच्छा सर, मैं आई एम गोइंग टू शेयर माय स्क्रीन सर.
वेलकम. आप जुड़ती रहिएगा तुल्या जी.
क्या हो गया सर? A very good evening to all. As we know, today is International Girl Day. I would like to convey that all the girls should be happy and healthy. Okay. And as my topic is gynecological disorder, teenage common gynecological disorder, I'm going to speak about this. Okay. Before we start the topic, I want to focus on the adolescence gynecological disorders. Like when we see the study as per conducted by AIMS, okay, these are the common problems every girl is facing during teenage age. Like when we see 59% of the girls are facing the problem by discharge or leukorrhea, 26% of them are having the problem of DUB, dysfunctional uterine bleeding, and 2% of them are having ovarian cyst, whereas 1% of them are having some infections, and 6% of the girls are facing problems like anemia. Okay, so first we'll do the classification, like age-wise classification. Sorry, age-wise classification, what has been told by our acharyas. So as Lakshmi Madam told, like it's the same thing, like as per the acharyas, we are dividing into two, like Balyavastha and Madhyamavastha. Balyavastha is up to 10 years. Kumari, it is up to 10 to 12 years. And Rajomati is 12 to 16 years. So right now I'll be dealing up to Kumari. Okay. Then Madhyamavastha, it can be classified into Yuvati, 16 to 40 years. Prauda is 40 to 50. And Vriddha is after 50 years. So this has been told in Ayurveda. पवन सर इसको ये आ रहा है ना, उसको कैसे ये करें? सर इसको छोटा करना है ना, ये हेडिंग आ रहा है, मतलब ये पट्टी
नहीं ठीक आ रहा है,
ठीक है,
पट्टी नहीं आ रही है,
नहीं आ रही है क्या? अच्छा, मुझे सिर्फ मुझे दिखाई दे रहा है. ओके सर,
नहीं.
तो we will deal with the common symptom in this age, that is anemia. Okay, sorry, before that, common health problems. So first one, we deal with hormonal abnormalities. So when I sit in my OPD, many of the students, and most of them will be from my own students, or our students, teenage or going age, all of them have some one or the other hormonal abnormalities. And nowadays we can see more cases of PCOD. Okay. Then next one is dysmenorrhea. Yes, I think every 1 in 5 children or 1 in 5 girls have this problem of dysmenorrhea. They complain about, kashta arthavam, or what we call is Ayurveda anarthavam. Okay. Then next is endometriosis and white discharge and repeated UTI, especially if they are staying in, I should tell, hostel. This is very common. Then anemia. So one by one, I will speak about this. So first one is anemia. So causes of anemia in teens. Why we see anemia is very common in teens is because due to heavy bleeding during periods. That is one of the major cause. Then iron deficiency anemia due to improper diet. Okay, because one thing is they are not aware about what diet should be taken, which is rich in iron. That is one lacuna. And another thing is vitamin B12 deficiency anemia. Then sickle cell anemia. Then aplastic anemia, when the body stops, creating red blood cells. It may be due to an infection or any other. If she has been suffering from any chronic illness, that can be also cause of aplastic anemia. Then PCOD, which is a burning issue nowadays. So when we see the incidence, globally, the prevalence of PCOD is estimated to be 5.5% and 12.6% in women in the age group of 70 to 40 of age. Okay, in India also, when we see the prevalence, it is more. PCOD is the major, I should say, which is a major cause of infertility nowadays in women. So the factors which are responsible for this is overweight and obesity, even the sedentary lifestyle, lack of exercise. Okay, that is also playing a major or risk factor, I should say. And the girls who are facing this PCOD, they are more prone to get diabetes in future. Then dysfunctional uterine bleeding. The main cause of dysfunctional uterine bleeding is the imbalance in the sex hormone. So either the girls who are going to have puberty or the women who's going to enter into menopause, they are the I should say the criteria who are more prone to have the imbalance in their sex hormone, and they are having this, prolonged bleeding. Okay, this causes heavy bleeding, or even they come to me telling that they have spotting. See, the ladies who are going to attain menopause, they say, I don't know whether my bleeding is stopped, because 2 months I had a normal thing, and now I'm having only spotting. So this has to be ruled out. Then next common problem what we face is white discharge. Okay, so this is a common complaint seen in all teenage girls, which may continue further ages if the general health of the girl is not maintained, due to if the lack of improper diet. Okay, if they're not following the charyas which is told by our acharyas during when she's Rajaswala, all this it may be due to stress also, so that also has to be corrected. Then causes of white discharge, when we see the cause, there has either it can be due to some infection or non-infection. So infection may be due to trichomoniasis, yeast infection, or gonorrhea. So the discharge, if it is mixed with blood or brown in color, it is due to irregular menstrual cycle. Or if it is due to bit cloudy or yellow in color, it can be due to gonorrhea infection. So in this case, the complaint of the patient will be like she's experiencing some pelvic pain or incontinence of urine. And yellow or green color discharge with a bad foul smell is due to trichomonal infection. Pain and itching while urinating is the major symptom what we see, they come and tell while they're urinating. Is the major symptom we find girls complaining due to this leukorrhea condition. Then when we go to non-infectious cause of white discharge, one thing is anemia, second one is the stress, third thing is before ovulation and before periods. See, before ovulation and before periods, somebody is having a white discharge is a very common thing which everyone faces, so nothing to worry about, and it is very physiological thing. So in this condition, we don't need any medication, but yeah, of course, for the stress, we have to relieve the stress. And regarding anemia, we have to give the girl child the diet which are rich in iron. Now we go to non-infectious vaginitis in another case, which we can see in a clinical practice, which occurs when there is an imbalance in the normal levels of vaginal bacteria, which may lead to inflammation. So these vaginal bacteria are important to our body to some extent, because they will be maintaining the normal vaginal pH. But if it is increased more than that level, it can lead to vaginitis. So what are the different causes of this? Is frequent use of soap, and nowadays we get different varieties of pads, and which are promising about it is having fragrance and fabric softness. Okay. Then, so what is the problem is the skin around the vagina may be very sensitive to the fragrance of the pad or the antibacterial content or the products what they're using. So if because of the long-term usage of these products, it can lead to vaginitis. Then another thing is vitamin D deficiency. It can also lead to white discharge, because the studies have conducted that this vitamin D deficiency play an important role in maintaining the genital immunity. So my request is, we can, along with our Ayurvedic medicines, we can also give vitamin D and vitamin C, because we all know vitamin C is again, it is playing an important role in general immunity of the body. So along with an Ayurvedic aushadhis, we can also recommend vitamin D and vitamin C. Again, estrogen deficiency. So estrogen deficiency is again one of the major cause for DUB and other gynecological problems. Now, another what we find in all the girls in this age group is UTI. So why only ladies or girls they have this frequent UTI problem is because of the shorter urethra compared to boys. And one more fact is because the opening of the urethra and the anus and the vagina all are very much in close proximity, I should say. So it's very easy to get the bacteria inside the tract. So that is one of the reason why we girls we are more prone to get UTI frequently. So other factors, which are the other factors which lead to UTI in women is sexual activity, certain type of birth control, especially the diaphragms, what we use, then menopause, because what happens in menopause, all the estrogen, progesterone levels, and as I told about the friendly bacteria which are playing an important role in maintaining the pH of the vagina. Okay, all this is going to decrease. So that makes and the calcium level also decreases. So all this is going to make the women more vulnerable to all the infections. So that is also one of the cause that when we attain menopause or nearing the menopause, we are more prone to get UTI. Then kidney stones, weak immune system, and usage of catheter. Okay. So next is gynecological problems according to Ayurveda. See, all the gynecological problems are basically related to Apanavata Vikriti. So either it is associated with Pitta or Kapha Dosha Anubandha along with Apanavata. So conditions like PCOD, the Apanavata is associated with Kapha Anubandha. Shweta Pradara or the whitish discharge is both Pitta and Kapha Anubandha. Pitta Anubandha, Shweta Pradara, discharge will be of foul smell and yellowish in color. And patient may again, present the case like I'm having burning sensation while urinating, or altogether she may tell, I feel the heat in my body. So that is another symptom of what we can find out when we take the case history. Then Kapha Anubandha, they tell that thick discharge will be there, and it will be very foul smell. And the main symptom which is very disturbing for the patient is they will be like very much irritated because of the itching part. So that is the main symptom of Kapha Anubandha. Now we'll go to UTI. So when you see UTI, it is the Apanavata Vikriti with Pitta Anubandha. As there is, when you see the UTI symptoms in general, they will complain about burning urination or yellow color, more yellowish color of urine, or sometimes they may also tell that it is mixed with blood. So Mutravaha Srota Vikara like UTI also is included, where Apanavata is associated with Pitta Dosha, where she experiences symptoms like pain or burning sensation while urinating, or urine with strong smell, and urgency in urine, or even some of them, not everyone I should say, some of them will find urine mixed with blood. Then dysmenorrhea. There is Apanavata with Kapha Anubandha. So there is Srota Avrodha in the Artava Srotas. So what we have to do whenever there is Kapha Avrodha, we can do Vata Anulomana. So because basically the problem is with the Vata Avrodha, and which is basically causing the pain and discomfort during the periods. Artava Dushti. See, in our classes, Artava Dushti, various kinds of Artava Dushti has been very beautifully mentioned by our Acharyas. So among that, I just try to correlate with the modern terms like Vataja, Pittaja, and Kaphaja. We can correlate with dysmenorrhea, and Kunapaganti and Puti Puya can be correlated with infectious conditions. Then Sheena Artava, the menstrual flow, Sheena, it will be conditions like amenorrhea or anartavam, what they say, which is very, very commonly seen nowadays. Because as Madam has just now finished, she told like even after some age group with 10 years or maybe 12 years, mothers will be very much worried that my girl has not attained the menarche, okay, which is very disturbing for them, because they will be, discussing with their cousins or their family members. So it will be very much disturbing for every mother that why my girl has not attained till now. So so Sheena Artava is again one problem. Or sometimes what happens is she has attained, and after that the flow is not proper. So that is again, it may be due to, as sometimes it is nothing to worry about. See, the problem may be with the anemia. Just when you follow the diet, which is rich in iron and which is poshaka ahara, like taking the grita and milk, all these dates, dadima, green leafy vegetables, all this may automatically, it may cure the problem. You don't have to go for the medication. Okay. And sometimes if the problem is with the PCOD, maybe many a times what happens is, due to the PCOD also, girls don't get proper periods. So in that case, we have to rule out PCOD and we have to treat according to the Nidana. Then next is Mutra Purisha. The menstrual blood attains the smell of the, Mutra and Purisha. So it will be usually seen in case of, advanced stages of cervical malignancy. Then Granthi Bhuta, Granthi itself indicates, it is very clear by the terminology. It will be something which is not, okay. So some fibrosis or something, cyst sort of condition, like which we usually see in ovarian cyst, or which seen in PCOD condition, changes are seen. So what are the Vikriti which is happening basically in all the, gynecological disorder? One is Agni Mandhyam. As we all know that when we talk about Kaya Chikitsa, it is the Agni is the main thing which is causing all the problem. So if the Agni is treated properly, most of the, diseases are cured automatically. So Agni Mandhyam is the major cause. So due to more intake of all this junk food, fatty food, and lack of vegetables, lack of exercise, vyayamam, and irregular sleep, all this may lead to Agni Mandhyam. So that has to be avoided by all the, I should say, young girls nowadays. And next Vikriti which is happening is Srota Avrodha. Yes, again this Srota Avrodha is basically due to Kapha Vriddhi. So there is no proper Vatanulomana taking place. So this Kapha dosha has to be cleared out. So that can be possible only by doing more vyayamam, or doing proper exercise, taking lagu ahara. Okay, lagu ahara, tarpana ahara, which is nourishing as well as lagu in nature, we have to suggest the girls. Then mamsa ativriddhi. Mamsa ativriddhi is again all this cyst, or whatever arbuda we find nowadays. All this is including, when we see the mamsa vriddhi lakshana also, we arbuda, granthi. So all this will come under mamsa ativriddhi. So PCOD is also one of the condition of mamsa ativriddhi. Then ati pravritti. Ati pravritti, excessive bleeding, what we see in DUB conditions, and even in white discharge. Some patients come to me, they tell it has been months together. They they have this white discharge, and they have to regularly change their undergarments, and it is so annoying and bad smell. So this ati pravritti can also be is one of the vikriti which happens in white discharge. So now till now I was just talking about what are the common problems faced by the girls who are in the teenage age. Okay, now we will go to the treatment. So first of all, the Nidanam Parivarjana, we all know that is a basic thing to be followed. So we have to first find out the Nidana and do the Nidana Parivarjana. So identify the Anubandha dosha, either it can be Pitta or Kapha. Then you have to correct the Jatragni, then do the Vatanulomana, and After all this, basically, you have to treat the general condition of the patient, like anemia and the stress, what we talked, which is more nowadays to all the girls, even the working women, everyone. So the stress, it plays an important role in the hormonal imbalance. So that has to be ruled out. That as you know, the family support, everything is included in that. So what are the internal medicines? See, basically these are the internal medicines I give to all my patients, like Ashtachurna. Ashtachurna we usually give when there is a Agni Mandhyam, or if they come with, they tell that I don't get proper, you know, even it is good for Vatanuloman also. This Ashtachurna also gives very good result in bloating, which we all find when during periods. So Ashtachurna is can be given to the girls who experience that pre-menstrual syndrome, like bloating, and they have you know, pain in different areas like thigh, back pain. All this can be cured with Ashtachurnam. Pushyanaga we all know it is very good, helpful in white discharge, and very good result we can find in Pushyanaga Churnam. Ashoka Arishtam, again it is a which will help in regulating the abnormal cycles. Yeah, of course it will take 2 or 3 cycles, but it has got very good result. Patrangasavam I have given to, again, PCOD condition, it works wonder. Patrangasavam. Then Chandanasavam, Draksharishtam, this is playing very good when it comes to white discharge along with very foul smell, and any Pittaja related disorder. Even they tell after many times, they just tell I have periods, but it is not coming properly. Like they tell it is just like spotting. They have all the symptoms, but once they take just even Chandanasana is fine. They tell me I feel the body is getting very heat. So just by cooling the body, the things works out. So this Chandanasavam plays a very good role in you know, giving in such conditions. Then Draksha Arishtam. Draksha Arishtam, especially when you find the patient is anemic. So if the amenorrhea is due to anemic condition, Draksha Arishtam can be given, Punarnava Manduram can be given, and Chandrapavati, when there is a UTI condition, more UTI related conditions, we can give Chandrapavati. And Shatavari Gritam, Shatavari Gritam, again, I have given to many patients. It works wonder when, especially in, you know, in dysmenorrhea, because we know like Gritam is equally good for Vata and Pitta dosha. So just by giving Shatavari Gritam 1 teaspoon along with milk nighttime after you know, bedtime, after food, just by giving this, they don't feel the pain what they experience during the periods. So I usually recommend my you know, all the girls or my patients, because we are all aware of our, you know, the dates. So I just tell them 1 week before or 4 days before, you start taking this Shatavari Gritam. Even the Sukumara Gritam. Sukumara Gritam also plays very good, because what happens during the premenstrual you know, syndrome, constipation is again a very, very major issue. All of us have that problem. 2 days before, 1 week before, we have all the symptoms: cramping sort of pain, bloating, constipation, and you have you know, we have that Amla Pitta sort of symptoms. All this can be, you know, cured by giving either Sukumara Grita or as I told previous slide, Shatavari Grita. Then Gugulu Tiktaka Gritam is again a very beautiful combination. Then Guduchadi Kashayam, Mushli Khadradi Kashayam. Yes, it is very good, you know, medicine for especially Shweta Pradra. Many of the patients have got good relief with this Mushli Khadradi Kashayam, and Varunadi Kashayam, which is Medohara, Kafahara, and more given in case of Uglutiktakam. Usually we gave combination of both in case of PCOD and other ovarian conditions. So the question comes whether we can do Shodhana in girls. I'm talking about before they attain the menarche. Can we do Shodhana in them? The therapists like Shodhana, say Matravasti, Kashayavasti, Utravasti gives very good results along with Shamana Aushadhi. But as the topic is limited to teenage girls, so we cannot give other treatments. We can give only Virechana. So Virechana can be with given with Avipatti Churna or Trifla Churna, or you can give if you feel that the Koshta is more Krura, we can give Nimba Amrita Eranda Thailam. That gives very good result along with milk, night time. So what Rasayana can be given? See, when we talk about Rasayana, we automatically what comes into mind is the old age. So here the Nitya Rasayana concept can be followed. So foods like Amlaki, Shira, Haridra, if we take in a regular manner, it works very good. And Navanita, yes, this is my personal experience. Like Navineta, which is told in our classics that it is Sheetam, it is Sheeta in Guna, and I am treated some cases like who are ladies who are attaining menopause, they are experiencing very heavy bleeding. So I have given from Himalaya, we get one Stiplon tablet along with this Navanita. So I just recommend them to take Navanita daily, 1 teaspoon, 2 times a day, and trust me, it has given very good result in condition like DUB. Then Amlaki Rasayana also can be administered. Yes, then patients ask like yogas, can we do yoga? What yogas we recommend to them. So yogasanas like Trikonasanas, Chakrasana, Dhanurasana, Tadasana, Padmamuktasana, all these prove to be very, if they're done in regular basis, they are proved to improve that hormonal imbalances. Then specifically, if you ask me like asanas for PCOD, Bhujangasanam, Shalabhasanam, Chakrasana, Konasana are very good in treating this PCOD. Then, as I told, the stress is very important factor in regulating our hormones. So, breathing exercise we can recommend to the patients. We can tell Kumbhaka. Like Kumbhaka, Raichaka, Vino. So in that, Kumbhaka helps in relieving the stress very effectively. So before I conclude, see, this is a beautiful quote which I got, like as Lakshmi Madam told, girl is, whenever in a family, a girl child is born, we in our Hinduism, we consider it to be a Mahalakshmi. That is very true. Okay. So Dashaputra Samakanya. So one daughter is equal to Dashaputra. That is equal to 10 sons. So Dashaputra Pravardhayan. So whatever phala, merits, good results a person attains by rearing 10 sons, the same phala is equal to rearing one single girl child. Dashaputra Pravardhayan yat phalam labate Matsen Labhyam Kanyeke Ekaya. So whatever punya we get, ek beti is equal to 10 bete. Okay. So never underestimate beti. Beti is Mahalakshmi, and beti, nowadays beti is the one they are carrying the family, I should say. She is doing double role. Ghar ka bhi role, bahar ka bhi role. Okay. So please, I tell, even I have got a beti. She is, she is in 5th standard. And actually, this is my personal thing. I'm sharing with all of you. I personally cried to Durga Mata that I want a beti. Okay. And on Friday, she was born. Okay, so from that day I started doing Navaratri Vratam, sir. This is my personal thing I am sharing with everyone, and I'm very happy that God has given me a daughter. Okay, so be proud, whoever is listening to me, that you have a girl child. Be proud of them. Okay, so all the gynecological health issues what I discussed today, all of them are equally burning issues in today's scenario and today's society, so which can be solved by proper diet and healthy lifestyle. Thank you, sir. Dhanyavad ji.
Thank you, Thulya ji. Thank you very much. Please do join whenever you have time and topic of your choice, please. This
Zarur,
platform
sir,
is yours, and recommend, because we are celebrating Ayurveda to negate the negativity of pandemic. We
Okay, sir.
started this celebration, and by virtue of God, blessings of God, and guidance from cooperation from Agnihotri ji, Vishnu Prasad ji, and Madan sir, रास्ते चलते गए और कारवा बनता गया. ये हमारा कारवा है. यहाँ कोई का कोई कॉमर्शियल उद्देश्य नहीं है. नई जनरेशन के लिए संदेश देना है, साथी डॉक्टरों के साथ चर्चा करना है और एक कंक्लूजन पे पहुंचना है. बहुत बहुत धन्यवाद. आपने बड़े अच्छे ढंग से और बहुत ही मतलब पावरफुल ढंग से कम्युनिकेट किया. अग्निहोत्री सर,
धन्यवाद सर.
थैंक यू.
आप बुलाइए, मैं आऊंगी. आपका बुलावा का इंतजार है सर.
थैंक यू. मैं हर महीने का प्रोग्राम 1 महीना पहले भेज देता हूँ.
जरूर, हर महीने में प्रेजेंट होंगी. हर महीना मेरा प्रेजेंट.
सो नाइस.
ओके, धन्यवाद सर.
मुझे एक मेरी नई छोटी बहन मिल गई, मुझे ये लगा.
अरे मेरे तो भाग्य खुल गए.
नहीं, खुश रहो बेटा, खूब खुश रहो. गॉड ब्लेस.
अच्छा, नमस्ते.
अग्निहोत्री सर.
लक्ष्मी मैडम चली गई.
थैंक
उसकी
यू.
तबीयत ठीक नहीं है, फ्रैक्चर
अच्छा
हुआ.
जी, अच्छा, कोई बात नहीं सर. अग्निहोत्री सर
वो
जी,
यूट्यूब
नमस्ते
पे
जी.
सुन रही होगी.
नमस्ते. थैंक यू सर. थैंक यू and a lot of thanks to our beloved Dr. Thulya Mohandas ji.
Thank you sir.
And before your daughter, you yourself is a daughter. तो
Okay,
दूर
sir.
जाने की जरूरत नहीं है. और आपने एक ऐसी बढ़िया वाली बात हमारे हिंदू संस्कृति के अंतर्गत कह दी कि आप बुलाएंगे तो हम आएंगे, आपको बुलाने का इंतजार रहेगा. भैया, बेटियां तो बुलाने पर ही आती हैं. ये तो वो वाली बात है. क्या चलते चलाते ऐसी बात कहती है. मैं कहता हूँ आप बुलाई हैं, हमारा रोज का प्लेटफॉर्म है, आप ज्वाइन करिए. प्रोफेसर पवन जी आपको रोज लिंक भेज देंगे. मेरा टॉपिक कोई भी हो, मानव मात्र के लिए अच्छा है. अब बेटियां अगर बुलावे से आएंगी तो फिर हम लोगों का हक ही क्या रह जाएगा. आप आइए, आपका प्लेटफॉर्म है, पहली चीज. दूसरी लाइट मूड की बात हो गई. दूसरी चीज, बहुत ही शब्द आपने प्रयोग किए जो कि आपको हिंदी, संस्कृत और अंग्रेजी सब पर पूरा अधिकार है. 10 पुत्र समा कन्या.
हाँ जी.
आपने टोटल निचोड़ ही दे दिया आखिर में. और ये आपका नहीं, आपका तो श्रम केवल इसको संदर्भित करने में, उसमें उद्धत करने में लग गया. 10 पुत्र समा कन्या 10 पुत्रान प्रवर्धयन् यत् फलम लभते मत्स्य तद लभम कन्या किया. एक कन्या के द्वारा. तो बहुत बढ़िया. मैं फर्स्ट स्पीकर के स्पीच में जब मैं सुन रहा था तो मुझे लगा कि ओवरऑल राइट फ्रॉम द वेरी फर्स्ट डे, जैसे प्रथमे मासे कलरम जायते से लेके हमें प्रत्येक गर्भ की पूर्ण व्यवस्था के अनुसार, जैसा कि हरि संहिता और सब में शिष्य में कहा गया है, चर्चा करनी चाहिए. क्योंकि मुझे ये तो नहीं पता कि गर्भ में क्या है, मेल है फीमेल. लेकिन चूंकि आज हमें चर्चा फीमेल चाइल्ड के लिए करनी है, तो ये जर्नी शुरू होती है उस समय से जब डिलीवरी हो चुकी होती है और हमें लक्ष्मी की प्राप्ति होती है. तो स्पेशल केयर हमें इसलिए करनी है तब से लेके, और मोटा मोटा मान लीजिए 25 साल तक या बिफोर मैरिज. क्योंकि जैसे ही महिला जो कन्या से फीमेल चाइल्ड की एज ओवर हो जाएगी तो उसको उसमें समझ भी आ जाती है. तो आपने जो क्षेत्र पकड़े, विशेष से कि आप काय चिकित्सा से हैं, लेकिन आपने गायनी के बच्चे दूर नहीं रह सकते आपसे. तो मुद्दा ये बना कि जो टीनेज की प्रॉब्लम है, जिसमें 30-40% अब तो थोड़ा मॉडर्नाइज हो गई हैं बेटियां, नहीं तो बताती नहीं थी. द मेन फैक्टर इज द शाइनेस.
हाँ जी,
फीमेल्स में
बिल्कुल
बॉन्ड साइनेस होती है, और दूसरे ये सोच के कि ये सिस्टम विशेष की प्रॉब्लम है, तो वैसे ही एक हाइडिंग टेंडेंसी बनी रहती है। हमें बताया ही नहीं है। मुझे ऐसे अच्छे से याद है अपने फैमिली मेंबर्स में ही कि फर्स्ट मेंस्ट्रुअल साइकिल शुरू होने पर, ऑनसेट होने पर, मेरे इनलाज की फैमिली में क्या हुआ कि उन्होंने वो जो अंडरगार्मेंट तो छुपा दिया, और ये
ओके,
डरती रही पता नहीं कहाँ चोट लग गई, क्यों ये ब्लड आ गया, क्या हो गया क्या नहीं। क्योंकि अगर बड़ी बहनें, बड़ी भाभियां अगर कहीं मतलब उनसे शेयर करती रहे या मम्मियां खुद करती रहे, तो बहुत चीजें सामान हो जाएंगी। क्योंकि दैट वेरी मोमेंट इज द मोमेंट वेयर यू नीड utmost hygiene,
हाँ सर,
utmost hygiene in the sense that os becomes open। तो वो सेक्टर आपने जो टच किया, जिसकी आपने हेतु बताया कि इससे ही लुकोरिया को लीड कर जाता है, इसी से दूसरी तीसरी चीजें हो जाती हैं, और एनोरेक्टल एरिया के और यूरेथ्रा के बीच में स्पेस या डिस्टेंस कम है, इसकी वजह से देयर इज मच मोर लाइक्लीहुड ऑफ द यूटीआई, रिपीटेड यूटीआई। सो ये आपने बहुत ही अच्छे कवर किया, और मुझे बड़ी खुशी है कि आपकी ये जो थॉरो नॉलेज है ये आपके स्टूडेंट्स को तो लाभान्वित करती होगी। हमारी वेबिनार को टुडे ऑनवर्ड्स, टुडे तो मिल गया, टुडे ऑनवर्ड्स भी लाभान्वित करती रहेगी। हमारी बहुत शुभकामनाएं, बहुत बधाई आपको, बहुत बहुत आशीर्वाद कि आपने जुड़ाव रखा और आगे रखिए। और बिटियां हैं तो हम बुलाते रहेंगे। धन्यवाद। ओवर टू डॉक्टर पवन शर्मा जी।
ओके सर, जय राम जी की।
जय राम जी।
थैंक यू वेरी मच। शाबाश। जय
जय
राम जी
माता
की
दी।
वंदना रहिए। जय हो, जय हो, जय हो। मातृशक्ति
आपने
आपकी
तो
जय हो।
पूरा समा बांध दिया, उत्तर प्रदेश, कर्नाटक और सब एक कर दिया।
जय हो।
चलिए,
ओके सर, थैंक यू।
Thank you. Now I would like to request Dr. C.P. Sharma, sir. Dr. C.P. Sharma ji is with us today. आदरणीय शर्मा जी, आवाज सुन पा रहे? Dr. Ankush will be speaker in our webinar. Dr. Ankush, how you feel it this webinar? Dr. Ankush, am I audible? मेरी आवाज आ रही है सर?
लाउड एंड क्लियर। यस।
सीपी शर्मा जी, हमारी आवाज आ रही है क्या?
सर आ रही है सर, एकदम क्लियर है
तो ठीक है
सर। वो अंकुश का ना थोड़ा नेटवर्क प्रॉब्लम रहता है सर।
थैंक यू।
अंकुश जी का नेटवर्क प्रॉब्लम रहता है हमेशा।
जगदीश्वर जी is from Mehboob Nagar, very senior expert. No, today is no question. इतना अच्छा प्रेजेंटेशन सबका हुआ, ग्रेट। तो कंक्लूडिंग रिमार्क्स के लिए मैं आदरणीय प्रोफेसर वीके अग्निहोत्री जी को आमंत्रित करता हूँ।
धन्यवाद प्रोफेसर शर्मा जी, नमस्कार। आज हम लोग अपनी 463वीं पायदान पर खड़े हुए और बहुत सी उत्साह के साथ में उस संतति के बारे में चर्चा की जो हम सबको जन्म देती है। संतति दोनों ही है। मैंने पहले भी कहा था कि संतति शुद्ध वंशिया ही परत्रेय च शर्मणे के साथ में शुद्ध वंश की संतति अब निश्चित रूप से इस लोक और परलोक में दोनों जगह अच्छे से एक प्रशंसा का पात्र बनाती है, सुख देती है। और आज की बढ़ती हुई परिस्थितियों में हमारे अपने 2 बड़े भाई लोग हैं, दोनों की 2 बेटियां हैं, और उनमें से एक की बेटी की 2 बेटियां हो गई, दूसरी बेटी की भी एक बेटी हुई। मीन्स स्थिति ये हो चुकी है, अब चलन में आ चुका है कि बेटियां भी अब अंतिम संस्कार अपने पिताजी का करती हैं। तो बेटियों की सत्ता को उस रूप से स्वीकार करने में और उनके आगे आने पर, उनके सशक्त होने पर अब सोसाइटी में कहीं कोई गफलत, कंफ्यूजन या शक, डाउट नहीं रह गया है। रही बात उनकी योग्यता की, वो पढ़ाई से, घर परिवार की समृद्धि से और पूरे मैनेजमेंट से अपनी पूरी ही अच्छी दखल दे रही हैं। और विश्व के संभवतः, विश्व तो बहुत बड़ी बात है, भारत के अधिकांश विभागों में सक्रिय रूप से काम शुरू कर रही हैं। विमान उड़ा रही हैं, अब मिलिट्री में आ गई हैं, एनसीसी में शुरू से होती थी, और कुल मिला के मेट्रो चलाना और इवन फीमेल सिस्टम में ऑटो रिक्शा तक चला रही हैं, टैक्सी ड्राइवर्स हैं। कुल मिला के उन्होंने अब जो लिंग भेद की स्थिति थी वो सोसाइटी से समाप्त हो चुकी है। तो ऐसी परिस्थिति में उनके स्वास्थ्य को बनाए रखने के लिए, और चूंकि फीमेल जो है वो स्वयं से खुद संतान उत्पत्ति में सबसे बड़ी जो है वो जिम्मेदार उत्तरदायी है, तो इसलिए उसके स्वास्थ्य, उसके शरीर की, उसके मानसिक, शारीरिक, आर्थिक और सामाजिक सभी पहलुओं के स्वास्थ्य के दृष्टिकोण से स्वास्थ्य को बनाए रखने की जो व्यवस्था है वो फीमेल चाइल्ड केयर की लेवल से ही शुरू हो जाता है। यही वजह है जननी सुरक्षा योजना से लेके WHO और विश्व के स्तर की जो हमारा भारत में भी जिनको हम इम्प्लीमेंट कर रहे हैं, उन सभी प्रोग्रामों को हम लोग चेकआउट कर रहे हैं। ये अलग बात है कि स्टेट वाइज, राज्य स्तरीय उसमें कुछ कुछ परिवर्तन होते रहते हैं, कहीं बहुत आगे से है, कहीं कम है, स्काउट है, गाइड है, हर जगह काम कर रहे हैं। तो हम उन सबका आज धन्यवाद करना चाहेंगे जो आज हमारी वेबिनार से जुड़े। आज तो हम लोग समय में विद इन टाइम है, बल्कि थोड़ा अर्ली है, तो जो लोग अच्छे लोग हमारे साथ बढ़ गए थे, उम्मीद थी कि प्रोफेसर कामिनी धीमान जी, मैडम वैद्य, पारुल जोशी जी कुछ और आज के इस विषय पर प्रकाश डालेंगी, लेकिन सबके अपनी व्यक्तिगत व्यस्तता के तहत इस समय हम बहुत कम ही लोग रह गए, केवल 7 रह गए, जबकि मैक्सिमम 21 तक हुए थे। तो हम अपने रिगार्ड्स पे कर रहे हैं प्रोफेसर पीपी शर्मा साहब को, डॉक्टर परीक्षित देवनाथ जी को, प्रोफेसर पवन कुमार शर्मा जी को, डॉक्टर अंकुश सलियाल जी को, डॉक्टर के वंदी कुमार केसी जी को, और डॉक्टर आयुष जी को, डॉक्टर योगेश्वर डोमा जी को, डॉक्टर कामिनी धीमान जी को, प्रोफेसर रामदास जी को, डॉक्टर उर्वशी पटेल जी को, डॉक्टर नंदी जी, डॉक्टर शीला वैद्य पारुल जी, प्रोफेसर दिवाकर प्रसाद जी, उनसे हम आज भी नहीं भेंट कर पाए। वो प्रिंसिपल है हमारे यहाँ पर, हमारा दिनेश यादव वहाँ पर असिस्टेंट प्रोफेसर है बिहार में, और डॉक्टर विकास अमृता जी, डॉक्टर जीवा जी, डॉक्टर जमीना मीमा जी, डॉक्टर लावण्य वी जी, डॉक्टर एस मोहन जी, और डॉक्टर मोमिता शर्मा जी, डॉक्टर बिनू जी, डॉक्टर अनु केस जी, डॉक्टर वसुंधरा राणे जी, और डॉक्टर सीपी शर्मा जी, और डॉक्टर शास्त्रिका जी, इन सब लोगों ने आज हमारे वेबिनार में भागीदारी दी। और हम अपने गेस्ट स्पीकर्स का बहुत बहुत धन्यवाद करते हैं, जिनके ज्ञान से आज की वेबिनार हम सब लोग लाभान्वित हुए, डायरेक्ट लाभान्वित हुए, श्रोता लोग दूर बैठे लाभान्वित हुए, और रिकॉर्ड के तौर पे उनकी जो आज की टॉक है वो हमारे YouTube पर आर्काइव में चली गई है। जब भी चाहे हम लोग दोबारा देख सकते हैं, क्योंकि बहुत सारे जो ट्रीटमेंट पार्ट बताया है वो बहुत ही इंपॉर्टेंट है, क्योंकि कॉमनेस्ट प्रॉब्लम इस समय डिसमेनोरिया और PCOD ये बहुत ज्यादा हो रही है, विच इज लीडिंग अल्टीमेटली टू द इनफर्टिलिटी आल्सो। So that is the time for the teenagers especially कि उनको फास्ट फूड नहीं खाना है, उनको डाइट पे विशेष ध्यान देना है, मेंटेनेंस लेते रहना है, कॉन्स्टिपेशन बिल्कुल नहीं होने देना है, और रेगुलरिटी मतलब ये पर विशेष ध्यान देना है कि मेंसेस रेगुलेशन वो अपने एक दिनचर्या में एक अपनी डायरी में नोट करें कि मेंसेस रेगुलरिटी के बारे में वो उतने ही अलर्ट रहे जैसे कि डेंटल केयर के लिए रहते हैं। तो ये वो कुछ क्षण है जहां पर वो स्वयं से, जैसे ही 10वें बार में स्टूडेंट बन जाते हैं, तब तो उनको ये जानकारी होनी चाहिए। उसमें चिकित्सा की जितनी भी विधाएं हैं, चाहे वो हम क्लासरूम एजुकेशन से लेके और अपने आयुष डिपार्टमेंट से, ये सब थोड़ा थोड़ा ऑनलाइन भी बताते हैं और असेंबली में भी बताते हैं, कई बार गेस्ट लेक्चर्स भी कराते हैं हमारे +2 के प्रिंसिपल्स लोग, और इवन डिग्री कॉलेज में भी गेस्ट लेक्चर इसी बात को लेके होते हैं, NSS के कैंप होते हैं, और उसमें चीजें बताई जाती हैं कि हम अपनी हेल्थ एंड हाइजीन को कैसे मेंटेन करें। हेल्थ एंड हाइजीन अगर मेंटेन रहेगी तो बहुत सारी हमारी जो व्याधियां हैं उनसे हम दूर रह सकेंगे। तो इन्हीं सब कुछ खास शब्दों के साथ में हम आज आप सबका धन्यवाद करते हैं, और विशेष रूप से अपने गेस्ट स्पीकर्स को बहुत बहुत बधाई देते हैं कि उन्होंने अपने ज्ञान से हम सब लोगों को लाभान्वित किया, और आशा करते हैं वो लोग आगे भी जुड़ते रहेंगे। थैंक यू सो मच। ओवर टू पवन शर्मा जी। नमस्कार।
कल वर्ल्ड अर्थराइटिस डे है सर।
जी सर।
कल डॉक्टर निशांत शुक्ला और डॉक्टर नीतू KS फ्रॉम कोयम्बटूर, they will guide us. Thank you very much. Good night to all. Thulya ji, good night.